G'day everyone! Today I've got a bit of an unusual episode for you. Have a look. I've got three models in front of me. This is a fitting. Again, what does a fitting mean? It means this is wax. See, it's wax. It's got this red colour to it. Especially since I've got the flash on. Turn the flash off. That's the colour it is. But what's the point of this work? From the title of the video, you've probably already figured out that here I'm asking the question, is it even possible to fit a denture onto the remaining roots, if you've still got roots left? I'll explain what it's all about. From my experience, there are patients who are really stubborn about not wanting to have their remaining roots removed, even though, again, according to dentistry and certain guidelines, there's a bit of a different view. Let's have a look at what's actually said about it. So mates, look, we turn to the internet and ask this question, can you fit removable dentures over remaining tooth roots without treating or preparing the roots? It's this exact phrase, without treating or preparing the roots. We've asked the question and now we'll get the answer. And here's what I got. No. You see that, yeah? It's written clear as day. No. There you go. Usually, removable dentures aren't fitted over remaining tooth roots without first treating and preparing the roots. That's due to a few reasons and so on. But as life shows, for some patients this actually works out pretty well in practice. And I've done it myself. It depends on a lot of factors. When the teeth were removed, which side they were first taken out from, how many years the person's been without teeth. And heaps of factors, heaps. To be honest, I've had patients who've gone 5 or 6 years without any teeth at all and without a denture, and they've still got enough bone volume. How does that work? I still don't get it myself. And for some people, as soon as the tooth's taken out, the bone starts shrinking straight away. So basically, what I'm saying is that this whole situation's really individual. But why do I support this idea, for example, when there are still some roots left? Let's imagine, here's the jaw, yeah, and there's a root here, another one here, maybe one over here, here, and here. That's the ideal situation. I actually had a patient with this exact situation about a year ago. He had roots left right here. I told him that, ideally, you shouldn't do it. You shouldn't put a full denture on those roots. Why's that? Because that's right, I was taught according to dental rules that roots should be removed, taken out if they're rotten, yeah? Or the roots should be restored with these special posts, metal ones. Like, crowns should be put on them, for example. And between the gaps, between these crowns, there should be some sort of denture, say a partial or something else. But I asked him, I said, why? Why don't you want to remove them? And he told me an interesting idea that I hadn't thought about before. He says he doesn't want to remove them so the bone tissue doesn't recede. And that got me thinking. There's actually some real logic in what he's saying. So basically, if you're in a similar situation and your roots aren't too rotten, so to speak, you could try to find a dentist. Why do I say try? Because not every dentist will agree with. You see, these days it's often easier for dentists to just pull out the remaining teeth and whack in 5, 6, 8 implants straight away and so on. So mates, if you've still got some decent roots left, just ask your dentist to fix them up for you. Firstly, so the root doesn't stick out. So you get what I mean, yeah? Just so there's no, look, I'll show you like this for example. So there's not a lump like this coming out of your gum. You get it, right? So that this sort of lump isn't there. If there's a rotten tooth sticking out, get your dentist to file it down or grind it off for you. Your gum should be nice and smooth. See, it's smooth, it's neat, it's been prepared properly, and a denture will sit really well on a gum like this. Taking into account that there are roots here, just make sure your technician, the one making it, knows that when the denture goes on top, it shouldn't be pressing on those roots, otherwise they'll get inflamed. So, what needs to be done? Just make a small recess around the roots in the denture and that's it, and you'll be laughing. The removable denture needs to rest on the gum, right here in these gaps between the roots. There you go, mates. But I've got 3 really interesting cases to show you.